Can a blood test diagnose muscular dystrophy effectively? Muscular dystrophy is a group of genetic disorders that lead to progressive muscle weakness and degeneration. When it comes to diagnosing muscular dystrophy, a blood test can be a useful tool, but it is not the only method used. Let's dive into how blood tests fit into the overall diagnostic process. One of the most common blood tests used is the creatine kinase test. This test measures the level of creatine kinase, an enzyme that is released into the bloodstream when muscle cells are damaged. In many cases of muscular dystrophy, creatine kinase levels are significantly elevated. However, high levels of this enzyme can also indicate other muscle conditions or injuries. Therefore, while elevated creatine kinase can suggest muscle damage, it cannot confirm a diagnosis of muscular dystrophy on its own. Another important blood test is genetic testing. This test analyzes a blood sample for specific genetic mutations that are known to cause different types of muscular dystrophy. For example, Duchenne muscular dystrophy is linked to mutations in the dystrophin gene. Genetic testing is often the most definitive way to diagnose muscular dystrophy, as it can confirm the presence of these mutations and help identify the specific type of muscular dystrophy. This information can also be valuable for family planning and understanding the prognosis. However, it is crucial to note that blood tests alone are not always sufficient for a complete diagnosis. Some types of muscular dystrophy may require additional tests, such as muscle biopsies, electromyography, or imaging studies. These tests help assess muscle structure and function, providing a more comprehensive understanding of the condition. The diagnosis of muscular dystrophy typically involves a thorough clinical evaluation by specialists in neuromuscular diseases. This includes reviewing symptoms, conducting physical examinations, and considering family history. Blood tests are just one part of this broader diagnostic approach. In summary, while blood tests, particularly creatine kinase and genetic testing, play an important role in diagnosing muscular dystrophy, they are not definitive on their own. A combination of tests and clinical evaluations is essential for an accurate diagnosis. If you suspect muscular dystrophy or have concerns about muscle weakness, consulting a healthcare professional is crucial for proper diagnosis and management.